listening to Promo Time on 99.3 FM, where Christ is the light. Join us again next time, someplace right here on 99.3 FM for another exciting musical show. Promo Time, only on Radio Maria, Yatsani Voice.
Your aspirations of healing mankind and a high-profile career are made possible here at the Lusaka Apex Medical University. We offer high-quality medical education with the best technology for your learning. You will learn from professorial teams dedicated to academic quality and standards. Enroll with us for Diploma in Physiotherapy, Nursing, Midwifery, Bachelor of Medicine and Surgery, Pharmacy, Science in Nutrition and Dietetics, Physiotherapy, Environmental Health, Public Health, Diagnostic Radiography, Nursing, Masters in Public Health and Radiology. In the new normal under COVID-19, we offer online classes where our students can interact with their professors. LAMU, where knowledge and excellence meet.
Welcome, our dear listeners, to yet another edition of the Lusaka Apex Medical University Radio Grand Round. And I'm your usual presenter, Stephen Chongo Mpuku. And today I have in the studios, as usual, Professor Taxon Lambert, who is going to take us through this topic. And of course, our dear listeners will open the lines so that you can contribute. Remember, this program is brought to you by the Lusaka Apex Medical University, and it is being carried live by Lumen TV, and you can access this on the Top Star Bouquet, channel 101, and also Radio Maria Yatsani Voice, including our colleagues in the Eastern Province, Radio Maria Chipata. So we welcome you and participate fully. Remember, at some point we'll open the line so that we can interact, and you'll be given a chance to ask any question and also contribute if you have something to say. It's now my time to introduce and welcome my guest. Professor, welcome.
Thank you very much, Mr. Chongo, and thank you very much, the viewers and listeners.
All right, and today we are not with Madam Shinondo. She will join us next week. But Professor will definitely,
as usual. Let me greet my bosses as usual. Greetings coming from our Vice Chancellor, Professor Lupando Munkonge, our Deputy Vice Chancellor, Professor Njeresani, and the Professor John Mudenda, my colleague, Director of Medical Education, all the deans and our prayer warriors,
yeah,
the registrar and the Dr. Msidi. We need to have prayers, so we really appreciate the prayer warriors, and of course from our acting chief executive officer, Mr. Vincent Msowe, I want to greet you. Welcome to the office. Now I come to Amarumbo Kuliresa. Today we'll be talking about the lake. And we must thank God for creation of the human body with all the efficiencies and protections. The leg is one side where you can see that Adam's body was well made. Because Adam was to walk on 2 legs. Mm-hmm. Well, wild animals, they walk on 4. So Adam has to walk on 2 legs, but provisions were given to those legs. We shall go into detail of that. Then I must say that for Apex Medical University students, whatever faculty you belong to, remember, prayer is the denominator. So when you are looking after patients, or you are in public, please show that you are prayerful and you are hardworking. Hardworking means you putting in extra effort at your workplace. Do like that. You will be very successful in the caring industry you have joined to look after God's people. So those are my introductory points.
Thank you so much. Like you rightly put it, we are going to look at our dear listeners, the veins and lymphatics in the legs.
Yes.
There. Now, you can start by explaining the anatomy and physiology of this segment.
Very good. Last week, we carried with us oxygenated blood through the arteries into the legs down to the toes. Now, when the blood reaches there, it has to come back. Mm-hmm. And some extra fluid outside the direct circulatory system, the fluid must be taken back. Now it's like this. We reach what we call arteriolar capillary phase at the end of the artery. The oxygenated blood enters the capillaries in the tissues, in the toes, for example. There is to deliver what the blood has brought. The most important thing is that blood has brought oxygen, glucose, and other nutrients. But it must carry carbon dioxide from the toes, the foot, the leg, back to the heart. It must also carry metabolic waste products. Those the cells have worked, they have metabolized. So what comes out in addition to carbon dioxide, there are other metabolites which must be taken out. The circulation, the job is to mop out, crop, take away, and bring in fresh supplies, and take waste products out in the cells of the leg or the foot or the toe. That is the capillary phase. It has arteriolar end, it has the venous end, where it should now carry blood, venous blood back. So last week we talked about arteries. Now veins, they start forming right at the toes, tissues in the toes. The multiple small veins, they group up and come to metatarsal level, where 4 veins are formed. Then in the plantar area, and the veins start now drawing blood towards the upper side. And you can imagine that blood must move from the foot to the chest.
Okay.
Now the system there is that the muscles are geared as they contract, as the toes, as we move, the contraction of the muscles, and also the pressure within the capillaries, they will help to deliver, to push the venous blood upwards. But between the two, there's also extra fluid going out. But the creation was such that the leg is the under exposure of many injuries. Mm-hmm. You know, as we walk, if you have no shoes on, you can injure your leg, you can injure your toe, you can injure your foot. So provision was given. How will Adam handle these things? So now the provision is the security system that was put in place. The lymphatics, which you mentioned.
Okay.
Lymphatics are parallel running to to make sure that the microbes, the organisms, they are running, they are now going with the veins.
The veins, okay.
Parallel, but not exactly in the same channel.
Okay.
They form their own channel, the lymphatics. Now, the lymphatics, the deoxygenated blood is being carried by the venous system. That's why it looks bluish. But the larger molecules, the veins don't want. The antigenic materials that the food might have come across, the veins don't want that.
Okay.
The microorganisms in the soil, the veins don't want that. So what happens, the lymphatics, these capillary level lymphatics, they receive, they are more permeable, they get larger molecules, they get microorganisms, they also take larger proteins, they also take the debris of the cells, and they are the ones that will receive these and start taking them back into circulation in their own channel of lymphatics. But provision, why was it done that way? It is the security. Because microorganisms must be destroyed before they go to the chest. So the lymphatics are connected to the lymph nodes. Now lymph nodes have anatomical structure. The zones, zone 1, zone 2, zone 3. Now zone 1 has got cells responsible for destroying microorganisms that might have come in through the injuries in the foot. And these are macrophages and the plasma cells. Lymphocytes, small lymphocytes, macrophages and plasma cells, they are in zone 1. Zone 2, small lymphocytes and macrophages only. So for a bacteria to cross zone 1, zone 2, very difficult. But zone 3, all antigenic materials, they will be mopped by zone 3. By then now, the lymphatics is cleaned up and is thrown through the medullary part of it, and the channel goes to drain now going into circulation of lymphatics. That's how beautiful it is. It's a well-defended human body. There's only one problem, that some of the bacteria, they're very virulent. And when they enter the leg, they will cause swelling in the lymph nodes, become swollen.
That's what I wanted to ask.
That swelling, please, that swelling is a sign of the battle. It's the body trying to fight the infection. That is the time where a patient should not be at home with a sore on the foot and the groins,
Yeah.
Groins are swollen with lymph nodes.
Lymph.
They are fighting. That's a very quick, any wound on the leg, please go to the nearest hospital. Report, because there are certain vaccines we need to give. For example, tetanus toxoid to be given. Because the tetanus, once it goes into the system, if you don't prevent it, 60% of patients will die when they get it. Those lymph nodes which are fighting for you, support them by going to your doctor and get antibiotic to reinforce the fight. The in-fight is already arranged. But can we get support by taking the medicine? So really the way we should control is that's the way we should control.
There was a misconception sometime back, maybe even now, that when you have those lymph nodes, it means that the bacteria and all have been killed. Now they have been stored in that area. We're awaiting,
to be discharged in the form of pus. Yes, sometimes the infection ends there, and it will form an abscess. It will rupture and have. But why wait until an abscess is formed? Whenever you are injured, please present. As I said, tetanus toxoid is something you will get quickly, and you will get antibiotic cover to fight the infection, to support the body, to facilitate healing. So that's the way we should look at it. Then the veins, if you are, the veins have said that the movement of the muscles, the toes, will pump the veins, to drain the blood from the foot up to the chest. Lymphatics also, with the pulsation of the arteries, the capillary pressure that is developed, the lymphatics will also be draining upwards to the chest. So these require muscle activity. Now, what do we do if a patient is unconscious, can't move the legs? Unconscious. That's why, even when you are asleep, deeply asleep, your movement never ends. I'm sure, Mr. Chongo, you don't sleep one side the whole night. You turn around. That is all in belt to make sure. But that's important. And you will see even the legs, the toes, they move. You are deeply asleep, but the provision, the creation of such that the lymphatics must move, the veins must move. That activity, even when sleeping, must be there. But now, when the patient is unconscious, that's where doctors say 2-hour returning. And when we are saying, give a bath to a patient, you will find that trained health workers, they have chosen to look after patients. They will also be exercising even the joints. Joints. And we have a cadre in the hospital setting called the physiotherapist. These people are very important because they will do the passive movements for the patient. And those movements must be there so that the blood circulation is going on. If you don't, deep vein thrombosis can occur. And that's what will kill the patient.
And what's that?
Blood clot in the vein, deep vein thrombosis.
So blood can't.
Now it has formed a thrombus, a blood clot in the vein. That's if difficult. It dislodges, it will go straight to right atrium. From right atrium, it will enter through tricuspid valve into the ventricle, right ventricle. From there, the ventricle will not realize that there is a blood clot, and if it stops pumping, what will happen to the patient? It will pump even the clot through pulmonary valve now to the lungs, impact, and the patient dies instantly. But the mistake is that we have allowed the blood clot to form. So physiotherapists, nurses, doctors will work as a team to prevent all this. There are some good medicines if we suspect that there will be blood clot formation. We give medicine like aspirin, clopidogrel, aspirin, especially aspirin, because it dilutes blood, it does not allow blood to form a clot. So we usually advise that. But what is important is the physical care of the legs so that we don't allow blood clot formation. But injuries, some of the injuries, Mr. Chongo, that God gave us, even created for us fertilizer source, ammonium nitrate, in the nitrogen component of the gases. But we have now added our own concentrations. We use the manure on the farm, and when there's an injury to the foot, in a manured farm, the danger is that you can get gas gangrene. This is a very vicious infection of a farmer or a farm worker. If you don't take the patient for treatment, may develop gas gangrene from the manured soil. So that is another very dangerous injury to the foot. So I've mentioned tetanus, gas gangrene, or injuries. Then the veins, I must mention the veins that you can also develop vein ulcers. Oh. Yes. If you see, the veins have got two channels, the deep venous system and the superficial venous system. By the way, the longest vein in the body is in the leg, called long saphenous vein. It drains the body. Then at the back of your leg, there's the calf area, calf muscles. Over there, there's also superficial, what we call short saphenous veins. If they are not draining well, if there's the pressure in the deep venous system, varicose veins can form. If you see dilated veins on your leg, don't keep it. Go to your doctor and show, please. The problem is gashe tizaenda mairo.
It becomes worse.
You know, that things become worse, and you can have a venous ulcer, varicose veins ulcer. That becomes more difficult to treat. So we must take care of the leg. The leg is very important, as you can see.
I thought it was just used for kicking.
For walking and kicking the ball.
Okay, let me allow you now to
Nyanja, yes.
so that we
Ziko omvetsera tilukamba za magazi yaenda bwanji uchoka kumendo ubwereranso kuchifuwa. So magazi yaja ya nyamula gasi jayo kutia sevenza kale carbon dioxide. So ipereka kumtima kumchifuwa. So magazi yaenda chifuwa cha maendedo ya mnofu wa mwendo. Mnofu wa mwendo tandizo pompa magazi ya sevenza ya nyamula carbon dioxide upereka kumtima ni mnofu. So ukazikira yai kufunika mwendo zikala bize unaka mwendo uzienda andumolo magona mzaona mnofu wa mwendo umaenda mchifuwa mutistileko puma vonse vitandiza kutima gazi ya zienda bwino mtupi. Andi ngati mnaodwala wokomoka sanga endese mendo esanu musina sina kumuzi kuja kutusina vama chita mazi yali womu amusina nakatawero amusina mendo mzaona kuti no pressure source. But chifunika tero ngakhala mchipatala mzaona akamba kuti tifuna maola yawiri yonse pakapita maola yawiri musandulizeni odwala tiopa kutanga chite vironda. Ziko.
All right, Ziko Mkwambiri, before we open the lines, maybe you can tell
one
us some
point,
of the...
if its lymphatics are blocked, because there are some conditions, there are some infections. I think those who have gone to East Africa, along the ocean there is a parasite called filariasis. It attacks the lymph nodes. And when they are attacked, the lymphatics are not moving, then the leg will swell. But the edema will be hard edema. Elephantiasis. Ati mwendo one kamonga wa elephant. Elephantiasis. That's what it meant. But also even the scrotal lymphatics don't drain well. So we have scrotal elephantiasis or leg elephantiasis when the lymphatics are blocked.
So both can be healed?
Yes, both. But the most important thing, in Zambia, the only area in Zambia which has filariasis, I don't know whether this parasite has followed the river Zambezi. Along Luangwa and lower Zambezi, when we are doing mobile hospitals, service, we found out that there are many patients with filarial infection. Wow. So there we must be giving prophylactic treatment for filariasis. Wow. They tend to have more hydrocele and more swollen legs if we don't manage them early.
Okay. Now, okay, you've mentioned those some of the medical conditions that present because of the physiology of the legs and what is connected to it, and what how the veins work and the lymph nodes and all that. So what are some of the medical conditions that...
Yes, so some of the medical conditions I've mentioned, like thrombosis in the veins, like elephantiasis when it's blocked. Sometimes they get infected, lymphatics can get infected as well. So, but all I'm saying is that these should really be checked. And two, if you have an ulcer on the leg, please get it treated, get it diagnosed quickly. Malegs ngati yatupa, mufike msanga kuchipatala, yatupa bwanji, mavenzi yaende sabwino, or there's a lymphatic blockage, we must find out. So don't take the wound on the leg for granted. We have to protect the internal life, the life in the human body, so that the infection is controlled before it moves from the foot to go and become septicemic infection.
Okay, there you are, our dear listeners. We are listening actually, and watching the Lusaka Medical Apex Radio Grand Round, and today we are looking at the veins and the lymphatics. And with me in the studios is Professor Taxon Lambert. We now invite your calls, your contributions on the following numbers. We have 0972 695200, 0972 695200, and also 0956 520277, 0956 520277. Tikuti mungambe kutuma tikuona kuri nkani ya mendo na matenda amene yamankhala kupende uyu. Already have a call. Hello there. Hello, our dear listener and viewer. Okay, don't seem to have that line yet.
Yes.
Seem to have that line yet.
Yes,
but,
so
we can
I wanted to say that when we have a leg which is swelling and we find that the veins are not draining well, we tend to ask the patient, please elevate the leg. We want a quick drainage so that the swelling can go down. Elevation of the leg is an instruction we give to the patient, or even the nursing team. If legs are getting swollen, we tend to elevate foot of bed to allow quick circulation, to minimize. Because what happens is that if lymphatics, for example, are not draining, the fluid that remains as the lymphatics will make hard edema. The the leg becomes swollen, but when you put your finger there, if it's venous, you find that you put your finger and the finger mark remains there. We call it pitting edema. But for lymphatic blockage, you can't pit the edema. It's hard edema. So it doesn't, the skin becomes hard. So those are things which we are saying, let's prevent them. Prevention is the better and cheaper than a cure.
Very cheap indeed.
Yeah.
Okay, we can still call on 0972 695200 or 0956 520277. Wombesera mungatume uko kuchipata Lusaka na konse kwamene mutitambira pa Lumen TV. Sono mungatume ma namba amene apasa 0972 695200 or kapena 0956 520277. Professor, what causes edema muri pregnant women?
Yes.
Yamavimba kambi benangu every pregnancy until they give birth.
Yes.
Yamayamba benangu it starts later on.
Remember that now the body which is expectant, there's increased blood volume. So the circulation is overloaded. Venous return can be affected because all these veins have to pass through the abdomen, inferior vena cava, taking blood to the right atria. So the baby can be compressing on the passage of venous blood. So that's the case. But whatever, if the legs are swelling, quickly go to the antenatal clinic and they should check your blood pressure. They should check your blood pressure, they should check your proteins in the urine, because it may be pre-eclamptic presentation. If you are not taking care, you may start fitting during pregnancy. That's eclampsia. We don't want that. So antenatal clinics are powered to check if your legs are swelling. Is it a pressure of the baby. Or is it a problem of physiological problem or pathological problem? Maybe blood pressure is high, is affecting your circulatory system.
All right. Okay, we are told we have a call. Hello, caller there.
Hello, good morning.
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 Good morning, Professor Lambert.
Good morning, sir.
Sir, you are not to the nation, you are a blessing and you live longer, sir.
Thank you. Thank you.
Yeah, Dr. Lambert, my daughter is 8 and she's had a pain on her knee. That when it comes, it's too much pain. And by the side of the knee, and then to move down to the tip and south.
Yes.
Try to move hospitals to an extent where we keep the CT scan. Maybe the doctor thought, there's nothing they can do as it were. This pain keeps the patient around that and continue to move down to the tip as it were.
Yes.
And it's something that is depressing. To say a week, she's drinking, to disappear and stuff. It keeps on coming just like that.
Yes.
Any advice, professor, that you can give?
Very good. Now let me answer. Very good. Sometimes we are carried away with the sight of pain. No, we should understand the pain properly, because sometimes the pain is referred pain. So where we are doing X-rays, there may not be the problem there. So pain is something which you experience through the nervous system. So the nerve that goes to the leg is called the sciatic nerve. It spreads and supplies the entire body. I'm very happy I've mentioned this, because we should look beyond the sight of pain. In this case, if they found the knee is okay, the ankle joint is okay, but the leg is still painful, they should look further and look at the lumbar spine, lumbar sacral spine, to find out what is going on at the level of nerve roots. I think that's where we may find a diagnosis. Thank you.
Okay, we have another call. Hello, caller.
Hello.
Hello, Mama. Mulibwanji.
Mwino mulibwanji.
Yeo.
Nine na tinifose. Nine na kazeni anapezeka na vuto akuti spine cord idyeka choka kumbuyo komanje yendirenda chakumukusi.
Ichitacha?
Idyeka.
Oh, idyeka.
Idyeka spine cord.
Aha.
So sinza kuti chirengesa nchani.
Now spinal cord, amai ni part of central nervous system.
Okay, you can cut it off so that you listen.
But ingataruona kuti idyeka, most likely it's the vertebral column. Now there are two ways of distraction there. If the distraction is between vertebral bodies, it's the disc that is being destroyed. We want to include in the history taking whether this patient had contact with a TB patient. Very common, because TB has been very common in the society. So we want to check if there was, is the disc getting destroyed because of extrapulmonary tuberculosis. If it's not the disc and it's the body, the vertebral body is getting destroyed, we want to know what has weakened the vertebral body. Is it metastatic lesions? So we must investigate this patient properly. And it seems that there's a multiple level type of destruction. The area the patient is taken to the doctor and do assessment head to toe, that diagnosis can be found and the treatment is started. Because if we don't, the spinal column will start bending. Forward bending is kyphosis. Lateral bending is scoliosis. But as it bends, it will affect the spinal cord. So the patient will start getting weakness in the legs. Very important. But let them go to the hospital, please.
Yeah. All right. 0972695200. Hello, our caller. Hello.
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 Yes. Mungakambise kwa mai.
Amadu makanzi.
Bwino mwachoma.
Nachoma ndimo kula msalambati.
Nezofuna ufunza nilikuwa problem
mchesti
mnaniamba April bwana enda kwa exeo vanuza ati nangeno wanampepo
ata nangene wana
ampepo
ati nangeno wanampepo
but mpepo ye nolowa mchesti lumba anyway so x-ray nalongoza kuti mnangene wana mpepo but mupe mabwino mukosomola
kumbuyo nezopema bwino manje hapa kuyamba pawenyuze tayamba futi kifuba futi zeni kupema kalila kaja kamukati kaja kuti kwi
lomba muyang'ane ngati kaja kachongo kachoka maningi popema kubwalo popema mkati ngati popema kubwalo. Yes, these are spasms. Yeah. Thank you. Lekani niyanka mai.
Munga cutting a phone so that
you see, I'm very happy she has made this call. People should be able to differentiate. If the difficulty is during inspiration, we call it stridor. It's a typical sign of upper respiratory tract obstruction. If the breathing out is difficult when expiring the air, then the lesion is deeper in the lungs. Spasm, like we get asthmatic attacks. You find asthmatic patients, breathing in is easy, okay. But breathing out, they have difficulties. That we call it wheezing because of the spasm, the reduced airway deep in the lung. So the doctor should listen to the chest and tell the patient, breathe in, breathe out. And you are listening. You will hear the crackles, inspirational or expirational. Very easy to make a diagnosis.
So in this case, what could be the probable cause?
Well, she's saying she has difficulties in breathing out. Yeah, so it's narrowing of the airway, but deep in the lungs.
Can it be?
Yes, it can be treated. In fact, one of the quickest treatment is to give her bronchodilator, and she will cough out the secretion.
Is that liquid medicine?
It's a tablet. It's a tablet. Sometimes an inhaler.
It sounds like an equipment.
Oh no!
Okay, we can still get your calls on the same line. Hello, caller. Okay, you can call again on the same line, the two lines that we are using. 097269.
Achonga mbuye wanalizi kuchipata. Abaita nenka.
Tabala sombola matata. Okay. Kaibo panga kobi.
Okay.
Hello. Watch your advisor zenda kuma peace work then wazanka na ya time. Hello, caller. We no mauka.
Adoko te mauka boy.
Na ukamai mauka bwa?
Ine nakuoso ine ndile mtu wa diabetes.
Aha.
Lomba nina kwa metformin na zamani. Lomba wedi anga ili pisi ndinayo ndana swinga 90 kg but manje nilipa 50. So ni oenda ncho peperuka neto panga mankwinya umumoto moyo ndaka ili mtukaona. Lomba sinizira kuti ni mankwana yati tisoso olubwani.
So muka checking ngati mankhwala yachita overweight yachita reduce glucose too much, that is again not safe, because the usual is the 3.5 millimoles to 5.5 millimoles. Inumkwapimisa fasting blood sugar izikhala pamena so that sugar izipezeka mthupi isamatheratu mukachita mukangatisira maningi mungayonde nditu. So muka checking mankhwala yanu ya jamunu ulandi ya lusevenza motani mwina akuchita na admit 24 hours observation kuti mukapasiwa mankhwala sugar ichita behave bwanji. But topic tina yolero amayi wa diabetes mwendo ngati simumvera mwendo wawa ndiye kuti tumanevu tumitsempa tuja tuluwonongeka na diabetes. Then mukazichite kumwendo osamvera wawa chilonda chija chingapangeja tikuti wet gangrene and infection ya diabetes is very dangerous. By the time mukachedwa even 24 hours mukafika kuchipatala kuti mwendo wawola mwapitirira pa nkhongono tienti dulire pa mwamba mwendo. Musazengeleze na mwendo wa diabetic akazichita ufunika opereka kuchipatala mwa msanga ufika kwa msanga. And ndidziwana na doctor wanu muchekinge sugar sakutaka lemba mankhwala lero wakulembera ni tablet ni muzimwa mwina ichita overweight mwina ichita underweight. So kufunika okhala kufupi na dokotala kuti apeze ma dosage yake ni yotani 7.
So amai mukaende foot hospital mukala
akakambira
right. Nina ndiko hospital panani HCT HB banani
aha ombana tibwanji
wale msikati ziziwe zivao dokta manane
manane machikora jamunga
muzifunsa no adokota mkakambe nawo adokota wanga nifuna nimuze kwa pamwalemba mwagani mwajipeza bwanji aza kuuzani guno bwino
ziko mwamai
ziko
na yani kila
kabwerere osa taking a time kwenda hospital
ziko.
all right, okay, you're still listening to the Lusaka Apex Medical University Radio Grand Round and getting your call right now. Hello caller.
Halo, mauka kwanje sango.
Wewe mauka?
Wewe buno buno paka mauka buno.
Na uka kai mfumo yanga.
Ndina pili nitumira ku yoga sana.
Inde.
Amen flow jabe ni flow jabe ya professor inejabe.
Ha?
Namba? Okay,
no,
mutume ikata program.
Manjeke ya chongo tikatuma kuyo lejoma hiyo pesa tikulipeka pa chongo atipase namba yao kuti ngati pase namba ya professor.
Wapase ni namba yao.
0979
0979
700 565 565.
Okay, ziko manatenga ziko manzatumba
zapunda futi na wena ngati bafuna mvera 0979 700 565. Olo mukatuma yapa radio yamene hii manje program ya sira tizasi ya namba mu studio wazambo mzano wa pa radio.
Okay, ziko.
Yeah, ziko mkwambi. All right, mambo tuma wena osatumira ine hapa, please mwelekera mwatuma after program. In the meantime, we are getting your calls and kamba tuona pamiendo misempa mavenzi matani hadi kumendo na madiseases. Hello
mwako bwanji
Auka
bwino ntumira kumtendeni kwa
good, very good.
Okay.
Nifuna nani nafunso nifunseko nima tita chizwezo nikakwera mosoka nimasoba kwa meni maenda so siniziva nikapena ngu niona ti uku nikwaso but nimafunsa choro kokwera basi kokwera mtendeni kuti but niki mtu wasokonezeka nikafika ko pasogolo na vuli ikafuti
memory.
Okay,
nanga munavuto la blood pressure or sugar or vuto ili ronse mtupimano
but nayamba nikali mwana nikali boyamba blood pressure.
But blood pressure mulinayo romba.
That is very social.
Romba blood pressure ilipo.
Hapa manje hapa pameona nipeza nayo.
Ya odi.
Munaza kazi ngati?
47.
Oh, you are a young lady, very young lady.
Okay. But adding to that, Professor, okay, munga cutting so that mveze bwino ku TV or ku radio, so that just adding to that, others wama luka ngati wakwera moto kakapanga ni diesel.
That's they don't like the smell of the car. My grandmother was not riding vehicles. She had also reaction to petrol. So, but what this lady, she good, she has asked. I want to talk about memory. There's recent memory and long-term memory. Recent memory, there's a part of the brain which deals with that. It's called the hippocampal gyrus in the temporal lobe. The job is to register new memories. What we see, what we hear, what we feel. It must register new memories. Now, if there's a problem in the head, like if blood supply because of hypertension is not reaching the brain well, these start appearing. But you ask these people who are like this, you ask all the memories. Yes, if you say, who is the president of Zambia? They will say, President Kaunda. They are in the old days. But who is the new president? They may not mention, because the recent memories are not being registered. So the most important is to go and let her be checked. For example, what is the electrical activity of the brain? So we use the electroencephalogram, EEG. We must check that. And two, she can go. These days, the country is very advanced in diagnosing intracranial lesion. MRI is the world standard equipment. They can check with MRI, including blood supply in all these compartments of the brain. Diagnosis should be made. So but also there's medicine which she can get to improve her memory.
Professor, can motion itself cause when you are in motion, maybe motion?
No, what she's saying, to allocate bus station, she gets lost. When she drops it, to know that I'm dropping now at the Mtendere bus station, direction can be difficult to find. So she must go to the doctors. And the best doctors to see is the neurological doctors.
Okay, 0972695200. We have a call. Hello, caller. Hello. Hello.
Tauka mai mulibwa. Tilibwino.
Amai ikanibwino phone kukamwa pokamba.
Ndina maketariki. Nitumila ku Tawama.
Inde.
Ngera mnadoko takuona nitatizi hapa ningela monga na mende yanga ya zale kamange. Mende yanga
zikomo.
Tawama.
Kunyasi kukova vojakira zina zimba mondali zilimanga mpovu. Nikaenda na ningi huku kunkokoloku kuna wala kwebe kuna letapo na kulala saini ili yonke kukala cheko akupya nikaenda mtungulo ngatina katiko mdomo munanzi nikazango donke kamanga nilikisikishi kinyeleza mnendo monse so i problem yankala forever nabwana ngapo kupatala kesho niuza mazao kila niuza sabe kuleta mpaka ya boya kala kuna maniziumu ya niuza afiraiti so niuza manje kali mankwala kulibesa na saseko mankwala alionse
but bankwala nirokupasani kwa kale arthritis kale uchan mankwala ya niropezeka anyway na team kafike kwa D2 but you know this is the today's topic. Okay. For the doctors ziko mamai ngata okupimani apime njira z'amagazi mujatina kambira femoral artery popliteal posterior tibial especially dorsalis pedis on the foot. They must know that blood circulation ya artery ibweresa bwanji. Then venous return, they should do, is it pitting edema or is it heart edema? That should be found. Is the heart working well? By the way, failure of the right ventricle, which pumps blood to the lungs, if it's failing, the legs are a very quick sign of swelling around the legs. So the doctor should examine the chest and listen to the heartbeats. First heartbeat, which is the closure of tricuspid and mitral valve closure, and the second heartbeat. We must listen to systolic phase and the diastolic phase. So first heart sound, second heart sound, and back to first heart sound. It means you have listened to both systolic and the diastolic phase. Is there noise in the heart? Because the heart failure is one of the earliest signs is the swelling of the legs, especially around the foot, the ankle joints. So she should be assessed.
She should be assessed.
Yes.
All right. Just to mention, Wakambati, it means that we are live on Lumen TV, channel 101 on the Top Star Decoder. And also, we are on Radio Maria and Sunny Voice and our Facebook page, by the way. Follow our Facebook page as well. You watch this broadcast. And also, you can listen to this broadcast on Radio Maria Chipata. So, those three, you are good to go. And right now, we're still getting a call. We have a few more minutes. We have a call. Hello? Hello?
Hello.
Hello?
Yes.
Yeah, Dr. Abbott.
Ewa.
The bank is
Eh?
Nina mulamu kumuzi. Papa muzipa chibisa petake tanofu.
Kwa chibisa?
Petake tanofu.
Oh, okay.
Anachironda chikulu ngako kukatende.
Oho.
So apalomba na kuyenda wenda lino kaya livene.
Oh.
So vantu zoje ta pakine mga kuchipata lomba kwenda katende kai chironda ichi chankala nthawi.
Yai. So yai pepani chifunika pa very quickly. Akatengeko kambali kachironda chija age ya chironda kuti chironda ichi tiwone chilibe kansa o china kansa and the treatment ichitike msanga chikalukulirapo chironda icho mzaona age yake ngati ni cancerous age ya chironda iyambo upanga mzera wake nditu vimbirapo ndiye kuti palivuto paja ngati ni flat chabe ma age ingakale metakambale venous ulcer can be another cause lero topic yale tu kamba za ma veins ngati si another kazi ngati
ni wakulu mwina ziko ana 70 chakuti
yewo batukula sudwala please wapelekeni kuchipatala mwa msanga
pelekeni ku hospital
yes
papa ziko mkwambie
ziko madokta
ziko mfumu yanga
professor
ndawana chibisa kuli chibisa sinda kwatu kuliso chibisa petauki same name I think impobale bwawa abantu
okay with makamba party the importance of movements and for basically the movements usually are made possible by the muscles.
Yes.
The condition where my muscles yafa.
My muscles is paralyzed. Yes. For example, if the nerve or if there's a stroke, the nerves are not the power of controlling the movement of the leg. Stroke in the brain, the leg cannot move. So that is a very difficult time. But tima pasa vijavoendera vingodo vija. But na also waja because ma veins galuchita supply ifunika mwendo ma sina uja mwendo samakala cha bezi ingapange blood clot.
Okay, let's see if we have the last call or second last call. Hello.
Hello.
Yeah, mama.
Kabwino.
Tauka.
Kambada mai.
Ndine purity ku chienje.
Inde.
Manje ambuya bezana gwati stroke manje ametumala yondolola kwenda kuti mavimba ka manje mwamuchitira.
Pamene banagwa munapeleka hospital.
Banamba kuenda bezoenda bati ikwendero dwala manje bezoenda manje tukaendolo lako ivimba futi.
Oho.
Rifunza pamene benzi banagwa mweza munawapeleka
hospital chita CT scan anachita scan. Adakamba banje scan wachongwa na dokota lomba akukamba kuti ma stroke there are two types, there's the hemorrhagic stroke and the thromboembolic stroke. Ngata anachita scan analemba vinachitika so that itidziwe ngati blood lupanga makloti or not. But mukapime nditu kuchipatala osa kazikira ndamwina ingakale second stroke.
Osa ingo bayo ndorola kunyumba peleke en hospital.
Ziko mamai mwachitabu inochita phone.
Okay. Yeah. All right. Sorry about that cut, but we can get one or two calls right now on this platform. Hello? Hello?
Hello.
Yafika.
Hello.
Good morning, sir.
Morning.
Yeah. This is Gasan calling from Nyimba.
Good Nyimba. Waona ka takrosa luangwa. Ziko
Magwisa shaba.
Yeah, my problem is my left toe got my left toe it got paralyzed.
Oh.
So I don't know any problem, but I haven't consulted this problem to any health personnel.
Ni to ikulu.
Sorry?
Ni to ikulu ija chala chikulu chija.
Yes.
chirinambu sichimvera olo mutsunepo sichimveka.
Okay.
No,
Afunza.
mvesesani mupite kuchipatala apime njira za magazi ndiposo apime mitsempha yamene tipanga kuti chala chiyende olo timvero wawa kuchala. Mupite mwamsanga kunyimba kuli hospital ka.
So ordinary hospitals wapima.
Angapime,
Njira
yes.
za magazi.
Yes, azapima doctor.
Mwambera mwikaende panyimba hospital.
Okay, sir.
Ziko mu machitabu no chitamwa titsuka ko maso.
Zaenda shawa kuwabuliza. Ziko mkwambili wa mdarwaka.
Okay.
At least tamvera kuti ku Eastern Radio Maria is working.
Okay, 0972695200. We get the last call and we wind the program. Hello there.
Hello.
Mulibwanji. Yeah.
Bomba sebwino.
Bomba sebwino mkwae.
Neni nkwata na problem ya mumutwe. Donc kwa mumutwe pali mwekiri. Ya.
Chirenda kui? Kukutwi? Mumutwe. Mkwae.
Nadia kuchana bata nje tabadiliki. But don't frienda sana sana. Jambile mu 2019.
Afyo mumfa nikuya kwati frienda mumishishi mumutwero mukati
not na kumishishi so mishishi palati na research mukati.
Okay.
Nombe ikine kwa COVID bantu ba Dr. Lambert bana bena patient
mas
nomba chinonshi kwa ba COVID kwa mona sana songa na lianda na
okay. So hospital ba mibita chani
bala ndira itapalisi limwezi lijonzi.
Okay. All right. They can veshe kulanda.
Mkwazi. So kutina temwa sana na namba yabo. Tuwabana mu community mwa ini mjoni kwa.
Okay.
Oh, very good.
Mutume hii ni namba mwatumina po. Abad paredu bala mpenanga yapa program that is.
Okay, na dote na sana.
Yeah.
Okay. Quickly, Prof.
Thank you very much. I think yes. I think the best thing is to examine the scalp itself, the cover of the head, and the nerves that come to cover, especially occipital area, they come from the neck. So is there any irritation of the nerves in the neck at the back? But in front here, we have what we call trigeminal nerve, which is supplies sensational part. But there's also facial cranial nerve number 7 for the muscles of the face. So it's better to examine it. But one of the investigations we should do is an EEG, so that we see the electrical activity of the brain. How is it?
Okay. Right. Thank you so much, Prof. We've come to the close.
Thank you very much. I love this participatory approach to this program. I'm very impressed. Lusaka, now Eastern and all that, that's very good. Remember, the people in Eastern Province, you do know that Apex has opened a pre-made facility in Chipata. Mr. Njovu is managing there. Our PRO is camped there to try and mobilize the students for our new facility in Chipata, Lundazi Road. So please visit that place, because we want our children to get the first part of training in the province itself. Chipata is a pilot. We are going to other provinces, because it's not that we chose Chipata. We think that Chipata is economically strong, and they will manage to support that facility by sending their children for training.
Wow.
But we are going to other provinces. Kasam, I'm sure Mr. Chongo is pushing me for Kasam.
Very much.
Thank you.
So what are we looking at next week?
Next week we have finished up to the foot now. We are going upwards. So we look at blood supply to the most important organ in the body. The brain.
Okay, thank you so much, Professor.
Thank you.
Well, our dear listeners and viewers, we've come to the close of the program. Today we were looking at the veins and lymphatics, and I'm sure we've gotten one or two. Remember, this program comes to you live every Tuesday on Lumen TV on channel 101 on Top Star, okay, and also on Radio Maria Yatsani Voice 99.1 FM and our Facebook page Radio Maria Yatsani Voice 99.3 FM, and also Radio Maria Chipata. I'd like to thank my guest on the program, Professor Taxon Lambert, and the crew in the studios. On the cameras we had our lady Messi Mshanga, and also the director of this production, Sydney Mwamain, and the technician is Martin Monde, and also the radio controls we had Felicitas Banda as well as Vivian Kavachi. I'm Stephen Chongompuko, and on behalf of the organizer of the TV production, Mr. John Smabudu, I'm Stephen Chongo. Like I said, enjoy the rest of the programs. Bye for now, and God bless you.
Good.